Okay, so this section is one of the bigger sections that we cover this term, because I would say out of all the species differences, most of the respiratory system, cardiovascular system, endocrine system, kidneys are all about the same in most of the species. But this section, there's a lot of species differences. Now, some of this will be familiar because this is stuff that you talked about in nutrition. So I know you've gone over herbivores, ruminants, hindgut fermenters. So there is a section in here that goes over nutrition. And since I know that you guys already had nutrition, I'm not going to spend a lot of time. I'm really going to focus more on the structures and the functions of most of the digestive system. But and when we get closer to the end of this, I will explain. But we will do a midterm this term. And it's usually after this section. So what I've done in the past is the midterm is half digestive. So half of the test is this new material. And then the other half of the test will go over cardio and respiratory. So it would be that. And when we get closer, I have some Kahoot reviews, and we would spend a day going over everything. So I just want you to realize that, that'll be coming, that we'll do that on this section. So starting with the digestive system, and again, knowing what they eat, an herbivore would be, and a ruminant is cattle and goats, and cattle is pertaining. Now, if you say cow is a female cattle, and a bull is a non-castrated male bovine, a castrated male bovine is a steer. So again, when you have large animal class, you'll go through those names, but that is the terms for those species, and goats as well. But I focus more on I use the cow as my model when I talk about it. And then a non-ruminant is a horse. Now cows and horses eat very close to the same material, they just digest it differently. And a horse is a hindgut fermenter. So, a cow is going to ferment their grain in their rumen. A horse is going to ferment their grain in their intestine. So that's the difference. They're hindgut versus foregut. And then obviously a carnivore would be cat, and they are the only true carnivore. A lot of people think about dogs as carnivores, but they actually eat a mixture. So anyway, so we pigs and dogs actually classify as an omnivore. Okay, sorry, someone's messaging me. Okay, so that's how we're going to do this. Now, when we talk about the digestion, and the whole purpose of digestion is taking larger molecules and breaking it down into something that can be absorbed, so to a smaller part. So when an animal eats a meal, they're gonna, when they chew the food, swallow it, moves into the stomach, starts being digested. But actually, most of the absorption is going to happen, the digestion absorption happens in the small intestine. So, things have to get broken down, but it has to be broken down into something that can be absorbed and can be used. And when it's broken down small enough, that's when it diffuses into the bloodstream, and then the bloodstream takes the nutrients to where they need to go. So a lot of, I've talked about a lot of things that are mechanical and chemical. If it's mechanical digestion, it's actually any movement of GI parts. The teeth are considered a digestive organ. So the chewing of the food. The esophagus has muscular contractions, and they move the food, but they also compress the food and break it up into smaller parts. So that is, and the intestines have peristalsis, so that is movement. Stomach churning, stomach contractions. Chemical is when, the food will meet like the acid of the stomach, or it meets the, the pH of the small intestine, and also digestive enzymes. So that is the chemical component of digestion. So you need both to be able to do what you're going to do. So we have to have both mechanical and chemical. And I will tell you, most parts, now the teeth would only be mechanical, okay? The esophagus is just pretty much mechanical. But once you get into the stomach is mechanical and chemical because it churns and contracts, and then it also releases acid. So that has both chemical and mechanical components to it. So I do want you to be familiar as we talk about different parts, what component of digestion is occurring. Now within the GI tract, this is the mouth opened all the way to the anus. It is one large tube. And if you remember, I talked about things that are lined with mucosa, the respiratory tract, because it's open to the outside. The digestive tract, it is open to the outside environment from the mouth all the way to the anus. So it's one long open tube, and it is lined with mucosa. And because mucosa provides a layer of mucus for protection in the digestive tract, it's also lubrication, but it is also to protect against, potential substances getting absorbed that we don't want to. And again, this is the basic structure. So we're going to go from the teeth, the mouth, the tongue, the pharynx, all the way down the esophagus to the stomach, the small intestine. Now, in this picture, there are a few organs that have digestive function that are outside the GI tract, like the liver. So the liver does a lot of things, but it has a very large part in digestion. But it is not contained within the digestive tract. The pancreas kind of hides right here under the duodenum. So the pancreas is an endocrine organ. We talk about it, we're going to talk about it, but it secretes digestive enzymes. So it has digestive functions, even though it's outside. So I will talk about, we're going to kind of start at the front and work our way down and talk about these different parts. And again, depending on what they eat is somewhat of how these parts are laid out. Now, everything from the oral cavity down, these are the structures of the GI tract. So anything in the oral cavity, which is like the teeth and the tongue, we've got the salivary glands too, from the esophagus, stomach, small and large intestine. And then the ones that are outside of here, and you may want to write it down on slide 4 or put some notes, structures outside the GI tract that you will need to know is the liver and the pancreas. Now the salivary glands, they are considered outside the digestive tract as well. So I'll only mention the salivary glands briefly, but the salivary glands have, saliva plays a role in digestion as well. So consider it part as well. Now, this is basically looking, if you look at a piece of intestine and you cut it in half and you're looking down inside the intestine, this is the structure. So mucosa, it's obviously a mucosal lined organ to, for protection and lubrication. But then there's submucosa, muscular layers, and serosa. So right here, you see this mucosa, and the surface of the mucosa has these, it's like a brush border. I'm going to talk about something called microvilli. Now, if you remember me talking about cilia, those are long and hair-like. They would be much longer. So that's what lines the respiratory tract. But the GI tract has these tiny little, I think I said to you once, there was a slide when we were talking about tissues, and I said, imagine if cilia got a buzz cut. So you have these long hairs, and then you cut them to this tiny little fine hairs. That's the difference between a brush border or microvilli versus cilia. So that's what this is. And then you have another layer of mucosa. So mucosa and sub, meaning underneath. And then there are two layers of muscle. This becomes important when we talk about how the intestine moves. There are circular muscle layers and there's longitudinal. But think about this. Longitudinal means long. When longitudinal muscles contract, they move things long ways. Okay, so they're going to move things forward. Circular are going to compress when they contract. So circular muscle segments digestive material, and longitudinal muscle moves it long ways. So there's that two layers for segmentation and peristalsis, which are two primary movements of the GI tract. And then the outer layer is the serosa. Now, if you were to help with a surgery, say it was an intestinal foreign body, or you open the abdomen and you see the intestines, what you see on the outside is called serosa. And if you remember, serosa is a type of tissue that secretes a fluid. So the intestines, they are part of that serosal layer of the abdomen. Okay, so the abdomen is a peritoneum. The serosa is a continuation of that, and it helps produce that fluid in the abdomen so that stuff doesn't stick together. So in the abdomen, we do not want to have a bunch of, things. We don't have a bunch of fluid. You just need enough fluid in there, kind of like the heart, so that things stay together. Or they don't stick together, I should say, that they can move independently. Okay, so that is the basic layer. And of course, there's a red and a blue vessel here. So when I talked about the blood flow, how we're going to continue it, remember when I said aorta, artery? What I would put here would be aorta, mesenteric artery, mesenteric arteriole, mesenteric capillary, mesenteric venule, mesenteric vein, vena cava. So the primary blood supply to the intestine is called the mesentery. And again, every area where you have a red vessel, you have a blue vessel, because you're bringing oxygenated blood in and deoxygenated blood needs to go out. So arterial blood in, venous blood out. So I will show you some pictures of healthy intestine and not healthy intestine, because if this blood supply for some reason is constricted or disrupted, the serosal layer is going to die, and eventually the cells in here are going to die, and the animal can get very, very sick, go into septic shock. So having a good mesenteric blood supply to the intestine is very important. Okay. Now, GI function, because this is smooth muscle, is going to be under what we say unconscious control. But there's two things that control GI function. Number one, the central nervous system, which is the autonomic system. So remember, in fight and flight, the heart, the brain, the lungs, the skeletal muscle needs the blood supply. So things that are innervated or controlled for smooth muscle, those functions actually slow down. So in fight and flight, your GI system slows down. And then when you're in rest and relax, or some people call it rest and digest, things will pick back up. Now, the endocrine system is a system of hormones that we're going to talk about later in this term, and they help regulate insulin, glucagon, digestive enzymes. So between the nervous system and the endocrine system, that is what controls peristalsis, digestion, movement of contents. And then when you see the word enteric, That always means think about digestive system or GI system. Have you ever heard of enteric coated aspirin? Or it's a medication and it calls it enteric coated. Maybe someone's heard of it or you haven't. Usually what that means is it would be like, say you could take buffered aspirin. If it comes with a coating, what the coating is doing is preventing it from being absorbed in the stomach or dissolved in the stomach. And what will happen, it's designed to let it be absorbed later in through the intestine. So they put a coating on the medication so that it doesn't dissolve the minute it hits your stomach. Now, if you take a normal aspirin and it's a white chalky pill, or you take an Advil or something, that medicine pretty much dissolves the minute it hits your stomach in the acid. But enteric coating will slow down the dissolving and the absorption of that medication because it's wanting it to stay and work a little bit later or further in the intestine. Okay, so that's what enteric means. But basically, there is an enteric nervous system, and then there's the central nervous system. So but I want you to basically know endocrine, and I basically want you to know the enteric system. Okay. Now, we're going to start in the mouth and work our way down. Now, I want to tell you, dentistry is a huge part of your vet tech education. It's one of the biggest sections on the board exam when people have reviewed it. You do a lot of dentistry in Tech 4. I want to say there's 2 weeks of material on dentistry. I am only starting the beginning of the basic parts of a tooth, but I'm not getting into the whole charting of the dental arcade. So this is just kind of an introduction, and it'll be brought up in a few other classes. And then in surgery rotation, you perform dentals and you do dental charting. So this will build, but having a good initial understanding of the dental formula, I'm going to talk about that. But if I say the oral cavity, sometimes people call it the buccal cavity. Buccal is pertaining to cheek. So when you see buccal, that means cheek. So if you think about anything contained between your two cheeks, which is basically your mouth, but I tend to say oral cavity more than I say buccal cavity. The vestibule is considered the spot between the lips and the cheek, and that's the outer surface of your teeth. If we say oral cavity, it's usually the what's between the inner surface of your teeth. So if I go in between my teeth and I push my tongue, that is my hard palate. The vestibule is if I put my tongue on the outside of my teeth, and that's between my cheek and my outer tooth. Now, surfaces of the tooth are going to be important because for charting, we name different surfaces of the tooth, and that's how you're supposed to chart and explain where teeth are, where they're supposed to be. So here is a basic tooth. Now this is a canine tooth, but let me show you what you're looking at. Okay. This is the bone in the jaw. Okay, wait 1 second, sorry. Okay, sorry about that. Here is the bone of the jaw. So this would be like the mandible, the lower jaw. This pink here is the gingiva, which is the gums. So the canine tooth, for example, a little over 60%, 50, 60% is actually in the jaw underneath the gum line. So what you see is only the very part. The part of the tooth you see is the crown. Think about if somebody has a crown on, you can see the crown on the top of their head. So when you look in the mouth and you see teeth, you're seeing the crown of teeth, and the coating is called enamel. The bulk of the tooth is actually dentin. Dentin is what makes up the majority of the tooth, and then it has this pulp cavity down the middle. So just understand there's a crown, a root, an apex, and the neck of the tooth. Now, what I want you to understand is when we call the tooth, think about a tooth having sides and parts. There's different surfaces. If it's a buccal part, okay, that has to be a part of the tooth that is touching your cheek, because buccal is cheek. So that would be any outer surface. So if an animal had an injury or a crack or a fracture in a tooth and it's on the outside, you would say fracture to the buccal surface. But it has to be what's touching the cheek. Right. Hang on one second. Okay, I was trying to tell my son to let Bo out and not let him in here. And then Bo just busted in here and he didn't let him out. So I'm sorry. It's so kind of crazy today. We'll get this down pat. Now think about this. The labial surface is pertaining to lips. So these front teeth are your incisors. The top and the bottom are your incisors. They touch the lips. Do your back teeth touch the lips? No, they touch your cheek. So if I said there was a cavity on the labial surface, you know it has to be on one of these front teeth, basically the ones between the canines. Everything from the canine back is a buccal surface because it's touching your cheek. Everything between the canines is a labial surface. Now, lingual is obviously on your bottom jaw, and that would be the inner part of your teeth that touch the lingual surface. Can I have lingual as a surface for my top teeth? Exactly. You can stick your tongue to the roof of your mouth, but lingual is always going to pertain to a bottom tooth. So if I said on a test, for example, if I said the top right premolar has an injury to the lingual surface, true or false, you would obviously tell me false, because there cannot be a lingual surface to the top teeth. Now, what you say for the top is palatal, because the top teeth, the inner part of all of your top teeth, touch the palatal surface. They face the palate. So lingual and palatal are both for the inside of the teeth, but one is the top, one is the bottom. Buccal and labial pertain to the top or bottom. Does everybody kind of understand that? Think about a tooth having a front and a back surface. Now, there's a few more terms that talk about like the middle and, like on the chewing surface, but you'll get into more of dentistry. So I'm just kind of like touching the surface, touching the surface. Anyway, trying to make it funny. trying to make it funny because I'm about to murder my son. So might as well joke before that happens. Okay, the structure of the tooth. Again, I've talked about the dentin is the majority of it. And what I want to mention here, so I already talked about enamel covers the crown or the top you see. Now, here is the gum line. Everything under here is in the bone of either the maxilla or the mandible, and it is under the gum line. What kind of keeps the tooth in place is something called cementum. Think about cementing the, you don't want your teeth falling out, you want them cemented into place. So in the bone, there is a thin line of bone called cementum, and it actually holds the tooth into the jaw, okay? Now, one thing to understand is the difference between teeth that species have, and I think you potentially talked about this in nutrition, so hopefully it's review. But there is brachiodont teeth and hypsodont teeth. Brachy means short. Okay, so let's think about it this way. Brachy means short. Dont pertaining to dentation. Carnivores, humans, pigs, the incisors of ruminants are actually brachiodont. What happens is they have a small crown. They have a small crown, which is what you see on top. They have a well-developed root, which is underneath, but they do not grow continuously. You lose your baby teeth, you get your adult teeth, and when your adult tooth there, once it pops out, it's done. You're stuck with that tooth, hopefully for the rest of your life if you don't have to have them removed or whatever. Now, horses, incisors, their cheek teeth, which are in the back, they call them cheek teeth, and that's a common term in horses. A boar, if you've ever seen a wild boar or you've seen them in a movie, and the boars have those really big tusks, they're really, really long. You know, a boar is an intact male pig. So a boar is a pig that has not been castrated. Okay, they can be very aggressive. Rodents. Does anyone know what a lagomorph is? What's a lagomorph? It is actually a rabbit. I was throwing out there if anybody knew it. So rabbits, rats, and mice, their teeth grow continuously. If anybody has had a guinea pig, a rabbit, a mouse, a rat, generally they are supposed to have like a wood block or something that they chew on, because what will happen as they eat and grind their food, and as they chew on these, they will naturally file their teeth down. But that's because they grow continuously. And if they grow too long, they can poke into their cheeks. Rats and actually rabbits can get a condition called slobbers. And slobbers literally means what it sounds like. What's happening is their teeth, they're trying to chew and they're poking their cheeks. And what's happening is it's causing them to drool or be slobbery. The other thing they do is they start to drop their feed. As they eat, because they can't chew properly, pieces of their food fall out of their mouth. So an owner might say they're chewing funny or they're drooling excessively. In horses, they get their teeth floated. What happens is they'll give the horse a little bit of a sedative, and they literally take almost like it's a file type instrument, and it goes back there. And what they do is, because the teeth get little points, and they'll go back there and file the points. Now, someone said, well, how come wild horses, they obviously don't get their teeth filed? Well, wild horses are foraging for grains, and what they eat as their diet naturally files their teeth down. The problem is you have a pasture horse, and he's eating the feed and the soft grains like the oats and things that do not require the filing of their teeth. And so a barn horse or a pasture horse is going to have a higher incidence of having to have these teeth floated versus something in the wild. And if you own a rabbit or a guinea pig or a rat, periodically they come in. When I've helped with this, and Neemer is always the best person to ask, but I've literally seen us take the little Resco nail trimmers, like the little rats, the little teeth are sticking up, and my boss will just go clip and clip them. I've seen people use Dremels and file them down, but if you're going to Dremel teeth, you're probably going to need some type of sedation. But I've seen us do this awake where they just kind of trim them, kind of like trimming a nail. You know, Tia, if you guys have class coming up with Neemer, ask her, because I don't think ferrets have I think ferrets are brachiodont. So I think they have teeth similar to like a cat or a dog, where once they grow, they're there. I think it's mostly, if you think about the species that, rodents, and, rodents eat grain. Lagomorphs are, like horses, they do eat some grasses and so I would ask, that'd be a good question for Neemer. Do you guys have her class right after mine, right? Coming up? Okay. Yeah, ask her that, and actually, Tia, report back to me tomorrow because I'm curious. But yeah, so I just want you to be able to tell me a species that has a brachiodont and a hypsodont, and what is the difference. Is that the hypsodont teeth are going to grow continuously. They have a large amount of crown under the gum line. So if you look here, okay, here's a brachiodont. Do you see the end of this root cavity is closed? See how it's kind of enclosed there? Now you've got some blood supply and nerve here. You've got the pulp cavity, but look here at the open root apex right there. So you see that's not closed. So what's going to happen is, and if you actually look now, if we were in school, I actually have a skull and there's some horse teeth in the skull. It's a horse skull. And you can actually see these points? So they kind of actually look like, think about like a scalloped edge on a knife or something. But what can happen is sometimes these points get too sharp. And because they're in their cheek, so horses, imagine if you're constantly trying to eat and you're constantly biting your cheek. So they can get sores, they can have bad breath, they drop feed, they drool, and you start to see all of these problems occur. So what they do is they literally go in and they file these down and make it smooth. But again, if a horse is eating something that they have to grind down more often, not soft grains, but more of the grasses and the hays, and then like alfalfa, they're going to naturally be grinding their teeth more depending on what they eat. So that is the difference. Now, basically, the aradicular hypsodonts lack a true root and they grow continuously. A radicular hypsodont, the apices, or the bottom there, they eventually will close and stop growing. But aradicular is without radicular root, aradicular, without a true root. So there is a difference there. But again, what I mainly want you to know is a hypsodont, the types of species and what that means, and then the okay, we're dreaming. And then the brachiodont and this. Now, deciduous teeth, some people call them milk teeth, baby teeth. I want you to know deciduous is the baby teeth. And all of them are born with two sets of teeth. They're born with their deciduous and their permanent teeth. Now, the deciduous ones, you can tell, are very small and very white. And they are present at birth, but they start to come through at different times. I will tell you, it's very common for us when somebody brings in a puppy. Now, if he was not sleeping and dreaming, I would try to open his mouth and show you his tiny razor teeth that he has right now, because he is very much trying to, like, you put your hand and we're very much wanting to teeth. And baby teeth tend to be very, very sharp, very pointy. But if we had a puppy come in, say we didn't know the age, say it was a stray, we can kind of age them based on the baby teeth. Now, if they have all their baby teeth, they are probably about 3 months or younger. They start to get the adult incisors, the ones right in front first, and they usually start to get those around 4 months old. The last ones to come in is going to be between the canines and the molars in the back. When you start to see an adult canine, then we probably are safe to say they're about 6 months, because sometimes it's hard to look back at the molar depending on the dog, but you can see the canine. So we can kind of age, and a kitten is similar. So a kitten and a dog are about the same as far as that, you know, they're going to get them start to get them about 4 months, and then 6 months the adults should be erupting. Now, the smaller the breed dog, the faster they get them. The bigger the breed dog, it takes a little bit longer, but that's an average. Now, I will tell you, when you guys are in the clinic, sometimes a puppy will come in, they're 6 months old, they're there to be spayed, and sometimes they have what's called a retained deciduous tooth. Quite often it's the canine, and you'll look and you'll see a canine that's kind of tiny and sharp, and then you'll see an adult canine behind it. So what happens is, as the adult tooth comes in, it pushes out the puppy tooth. Most of the time, you don't even see these, or the owners don't even see these. It's usually as they eat and they chew their food, they swallow them. I know that sounds weird, but usually that's what happens. I found one of Bo's baby teeth, and he was chewing on a rope toy, and I went to pick up some toys, and then I saw it laying on the floor, and I was like, oh, my baby, one tooth. So other than that, I mean, he has all of his adult teeth, then obviously he ingested them all or didn't see them. So that's usually what happens. I do want you to know the 4 types of teeth, okay? So incisors are the ones here in the front. They typically are the ones that will grab or tear food, okay? They don't really chew with their incisors. They're more for like grasping. Canines is another, puncture and tear. And so you've got the canine here. And like I said, most of the roots of these teeth are in the bone, but look how deep the canine is. So it's a very large tooth. The majority of it is in the bone. Behind the canine is the premolars, or caudal to that, and then you've got the molars in the back. So the molars and the premolars are more for the grinding, breaking down food, you know. And I don't know if you guys talked about a nutritionist jaw translation, where the jaw rotates. So there is that as well. I want to stop here because I'm going to talk about these again, and then I'm going to talk about the dental formulas and how that works and which ones that you'll need to know. Just if you want to know now, you'll need to know the canine adult formula and the bovine adult formula for the test. Those are the only 2 formulas that you'll need to know: canine adult and bovine adult. But I'm going to talk about this. So we'll pick up here tomorrow. And hopefully everybody put here in the chat. So does anyone have any questions? Yeah, I have a lot to get done today. Like I said, we got home late on Tuesday night getting him. Like, we didn't get home till about 10 p.m. And then, of course, that was a very long night. And then last night up pretty late. So, and trying to corral the 2 of them. So I'm hoping today to get a little bit of a break. I'm going to try to take a nap. I couldn't yesterday. And, you know, Bo, no. I'm gonna murder my son. So it's driving me crazy. So yes, I'm going to try to get into those tests and get the homework sent out to you. If I'm guessing, I don't even really want to guess yet. Let me spend some time looking at the notes, looking at the calendar, because we also have, I believe we have Monday off. Should be Memorial Day as far, yes. So I got to kind of look at the dates and see when we're going to potentially do this test. So you guys have a good day. I don't want you to be late to Nemer. Thanks for being patient with me. Sorry that we had to start a little late. I got Snoozer here, so I need to go feed him breakfast. You guys have a good day, and I will see you at 8:15 tomorrow. Hopefully, I said we're hopefully getting in a better routine here. All right, I will see you guys later.